All right, and now deadlifting with lower back pain is really, really taboo, and it has, there are a couple conditions that I would not do it with, especially things of instability to the spine, spinal listhesis, slippage, and basically instabilities, like I said. So before you do any of this stuff, make sure you speak with your doc and make sure it's good for you. But there are studies which certainly validate it and say it improves lower back pain because of posterior chain development. So what we're going to show you is a variation here of, we're going off of blocks that you see. This is our style of blocks. We just use other plates, mainly because sometimes lower the position, their form falls apart. So there's a couple things we can do from blocks. So go ahead and give me, Marielle's going to give me some straight-legged deadlift, mainly so you can see variation. I don't like stiff-legged that much, personally. And we're going to look at her knee angle on this. Notice that when we get to the bottom, her knees are going to be fairly straight, but her back's still flat, so she's got some good form. Now, I would say that people that they're doing these with less knee bend have a higher potential of injury than the ones who bend the knees a little bit more, mainly because their flexibility, that person's independent flexibility. So to decrease risk, a lot of times we ask people to do more of an RDL, so give me some more knee bend. She still has a butt significantly higher than the knees, so she's still going to get a lot of posterior chain activation. Notice that the spine is straight. Now give me a little bit more butt dip here. So technically a deadlift is anything where the knees are still below the butt. So this still counts, but some people who are not as flexible are going to take this much better. I think the worst thing you can do is throw someone into a position their body doesn't tolerate. So these are the variations that I typically use with people. Again, you might move from higher blocks as well, depending upon what they're feeling. So there's nothing wrong with going from a hang position as well. So this is something I would add, but be very, very, very cautious and make sure that they've talked to their doc first.